The Government of Mongolia and the Governor's Office of Holskolth IMAG, United Nations Children's Fund presents the Child-Friendly Community Program.
I am delighted to share a few introductory remarks to this video, documenting the progress on child health and child survival in Huskul IMAG in the context of the cooperation between UNICEF and Government of Mongolia. Mongolia has achieved tremendous progress on child survival, in particular by achieving Millennium Development Goal number 4 with almost five-fold decrease in child mortality compared to the level in 1990. However, we still have challenges, especially in persisting inequalities of child outcomes and stagnant decrease of some of the causes of child mortality. There are widening gaps between rural and urban and poor and rich. For instance, a child is 4 times more likely to die before his or her 5th birthday if he or she is born in the western regions compared to children in Ulaanbaatar. Moreover, a rate of major preventable causes of child mortality remains stagnant, such as newborn asphyxia and pneumonia, since 2005. In Huskul IMAG, the situation is also as aforementioned when we started the intervention. This is why we support the Huskul IMAG and Huskul Health Department to implement 3 key practices to address the situation. Reaching every Sum to address inequalities with a targeted approach. Ensuring early essential newborn care to address newborn child survival. But also communication for development, very important to prevent pneumonia, diarrhea, and newborn complication. And UNICEF use a AAA approach of program implementation based on assess, analyze, and action to implement those activities. Huskul Health Department is now working hard to sustain the gain obtained through improved local budget allocation and remove of systemic bottlenecks such as shortage of human resources and availability of essential commodities. And yes, we can say that we saw progress there in Huskul, and we want to celebrate also that progress through this video. Thanks to this approach, under 5 mortality rate in Huskul decreased by 34% as end of 2014 compared to the rate in 2012. Through this video, we want to attract interest from other IMAGs and districts to replicate such a successful story. We believe that we saw a good, promising approach in Huskul. A nice story for children, a nice story for Mongolia, a story that we want to tell through this video. I want to thank Governor Ender Batar, Huskul head of the Governor Office Tumur Batar, and Dr. Damdin Suren, head of the Health Department, for their leadership and commitment to write this beautiful story of progress for children. UNICEF is proud to be part of this, and I hope you will enjoy the same energy and the same commitment for children that we all do. Thank you.
These people traveling long distances, notwithstanding difficult terrain, unpaved roads, and harsh weather, are outreach workers of Tsaganur Som Health Center in Holskolth IMAG. They are on the road to deliver healthcare services to remote households in the Western Taiga. After traveling 25 kilometers from the Som Center of the foot of the mountain by car, they continue their mission through harsh terrain on horses and reindeers. It takes at least 4 to 6 hours to reach the nearest household in Taiga.
The western and eastern taiga are quite remote. The western taiga is famous for its rocky cliffs. Roads in the eastern taiga are muddy and slippery. In summer, the area is overrun with horseflies and mosquitoes. Nonetheless, we deliver health services despite these challenges. This is simply our work, our responsibility. The priority target groups for our outreach team to provide services are pregnant women, mothers, and young children.
At the end of this long and difficult road, there are households and people left out of health and social services. They should be reached with services. The outreach team headed by Dr. Tuvjin Shagath includes Bog Dr. Ganbat and vaccination nurse Uldzinyam. Dr. Ganbat has worked as a bog doctor for more than 30 years and has passed many times through narrow taiga paths on horse or reindeer back to deliver health services to reindeer herders.
We visit reindeer herders twice a month. At the beginning of the month, the bog doctor visits the households, and at the end of the month, the vaccination nurse joins. There are generally few complaints and morbidity is decreasing.
Fuji's family leads a nomadic life herding reindeers. This year they have welcomed a new member to their family, a son. Their son has turned 2 months old and therefore needs to be vaccinated according to routine vaccination schedule.
Do you exclusively breastfeed your baby? Yes. How often does the baby pass stools? How well does he sleep at night? The baby sleeps well. He passes stools every other day.
The outreach team has arrived as planned in spite of long distance and harsh terrain. They are checking the health of the mother and the growth of the newborn. Høgskoleimag is set to become a child-friendly province by 2016 and has embarked on implementing the Reach Every Somme, Bog and Citizen policy with a technical and financial support from the United Nations Children's Fund since 2012. As a result, early prenatal care coverage increased by 20%, childhood morbidity and mortality declined, vitamin supplementation coverage improved, and vaccination coverage reached 100%. The outreach team of Saganur Somme has completed maternal and child wellness check and routine vaccination. The team also checks the health and well-being of the elderly, provides them with necessary medications and health counseling, and carries out fitness tests twice a year. In addition, the population is surveyed about the delivery of education, nutritional, and social welfare services.
Our Somme outreach team makes its monthly visit as scheduled. They have never been late. We cannot always go to the Somme center and have our children vaccinated on time. It is cold to travel with the child in winter, and in summer roads are muddy and the areas is overrun with flies and mosquitoes. We appreciate that health workers visit without us having to make such a difficult trip. My son is 2 months old, and today the team has provided routine vaccination.
Volunteers play a key role in providing healthcare services to all who need in a timely manner. Gesek Sogt and his family have dedicated more than a decade to health volunteering.
I'm a health volunteer. I enjoy working with the bog doctor and doctors. I help the doctors with horses and reindeers during outreach. It's rewarding to help out the doctors with whatever I can.
He regularly visits bog households, provides health information and counseling on disease prevention, and communicates without delay information about the health of children, pregnant women, and the ill to Somme and bog doctors. The outreach team members identify residents with needs for education, welfare, and other social services, and ensure their needs are met. Gan Bater is a resident of the Eastern Taiga who has been able to receive welfare support for his 2 children thanks to the help of Saganur Somme's outreach team.
One of my children is visually impaired and the other one has cerebral palsy. I went twice to IMAX Center, which is 300 kilometers away, in order to enroll my son in welfare support scheme, but to no avail. Last spring, around the 10th of May, social welfare officer and some doctor visited us and took my son to the Somme Center for check-up and enrolled him in the welfare scheme. I am saving the welfare benefit money so as to take my son to Ulaanbaatar for treatment.
Doctors and healthcare workers from the Høgskoleimag Health Center identify, map, and register vulnerable, remote, and unregistered target populations in order to provide health and social protection services to all mothers and children equitably.
Our Dalai-built Family Health Center has started implementing a Reaching Every Somme strategy since 2012. Our Family Health Center services a catchment area with numerous temporary residents and herders. Therefore, we were selected as the starting point for the implementation of the Reaching Every SOM strategy. We work in teams composed of doctors and nurses in order to implement the strategy. Doctors and nurses visit every household in the catchment area in order to identify target population groups and map the location in order to provide them with health and other social protection services. Since the commencement of the strategy, we have delivered outreach services to 2,560 for individuals, including 672 children aged 0 to 5 years. In addition, we have reached 426 pregnant women with health and social services.
Ochgelith, a temporary resident of Murun Som, arrived to Murun Som from Ulaanbaatar when she was 4 months pregnant and has delivered her first baby here. Once in Outland, the pregnant woman has received health information and counseling in an amount and frequency not seen in the capital city. Biamba, one of the health volunteers who help doctors to deliver health information and basic services to those in need, has provided prenatal care and information to Ochgelith during her entire pregnancy.
I needed stitches after delivery. I did not know how to care for my stitches and for my baby umbilical stump. The health worker helped me with necessary information and counseling. I appreciated indeed such outreach services.
Within the framework of the child-friendly IMAG program, every SOM and BOG of Holskolth IMAG is working to provide comprehensive outreach services for maternal and child health prevention, protection, and care. Furthermore, a communication for development strategy is implemented to provide parents and caretakers of children under 5 with necessary information and knowledge.
Communication for development strategy is very effective. We are implementing this strategy jointly with the United Nations Children's Fund. As a result of health education trainings for parents organized within the framework of strategy, there have been no cases of inpatient admission or death due to a complication of diarrhea and pneumonia among 0 to 59-month-old children in the past 2 years.
Intersom Hospital of Ich Ulth Som in Holskolth IMAG offers trainings on childcare and nutrition using novel methods such as individual and interactive trainings and role plays. This time, a training on infant and young child feeding is organized using role plays. Mothers and grandmothers attending the training are demonstrating how they feed their young children and what problems they face. Then they share their opinions and experiences with each other. During the discussion, the trainer points out wrong practices and provides information and counseling. Such trainings based on real-life scenarios have helped to resolve misconceptions and inadequate behaviors by more than 80%.
My child was anemic. I have learned from this training how to treat anemia through proper nutrition. Ever since, I tried to enrich the meal to my child with various foods and supplements. Now my baby is 10 months old. It is also good to provide multiple micronutrient supplementation starting from the age of 6 months. My child had 2 packs of micronutrient supplementation at the age of 6 to 7 months. This training has been crucial for me to learn how to feed, provide food supplements, and prevent anemia in my child. I used to feed my child 2 to 3 times a day. I was underfeeding my child. During this training, I have learned that young children should be fed 5 to 6 times a day every 2 to 3 hours. As a result, I now correctly feed my baby.
Ink Jagath, a native of Ich Ulth Som, regularly attends the training and improves her knowledge. She has 5 grandchildren. Her children left for cities and traveled abroad in order to study and improve their livelihood. So she has an important responsibility to raise her grandchildren. Ink Jagath grows vegetables and fruits in order to provide rich and nutritious food for her grandchildren. She practices every new knowledge gained from the trainings and continuously improves her knowledge of childcare and nutrition.
I have learned many things regarding healthy upbringing of my children. When I was young, I used to cool down food for children in our mouths. This is no longer acceptable. Everybody, irrespective of age, should try to attend trainings as much as possible and learn new things.
A maternal and child health training is taking place at the health center of Sagan Ur Som in Holskolf Imag. We saw a role-play model used in training in Inter-Som Hospital of Ich Uth Som, but here in Sagan Ur Som, health workers combine classroom teachings with hands-on practice. The trainer and one of the mothers are demonstrating how to prepare at home an oral rehydration solution for use in diarrhea. Hand hygiene of family members is the most important thing when caring for a child with diarrhea. Therefore, trainees have been advised to use liquid instead of solid soap and a proper hand washing technique that's been demonstrated. These simple yet effective practices are important to protecting the health of children. Fathers are asked to wear a special outfit filled with 11 kilos of sand and to pick up things from the floor in order to help them experience the load of the last few months of pregnancy. They are also asked to name common danger signs of pregnant women.
Headache, nausea, lack of fetal movement or excess movement,
What else?
edema, diarrhea, edema, bloody or watery secretions from the vagina, right?
Now try to wipe out the floor. Wipe out the floor, milk the cows, and do everything else. How are you feeling?
It is indeed uneasy. I have experienced it with my own body.
Classroom trainings coupled with hands-on practice and organized in a self-renovated training cabinet using self-made training materials are bearing their fruits, and maternal and child health indicators are improving.
In 2013, we had a total of 326 hospital admissions, and the corresponding number has decreased to 288 in 2014. Similarly, the number of admissions of 0 to 5-year-old children fell from 61 in 2013 to 50 in 2014. A year ago, in 2014, we had one child death, and a year later, in 2015, we have no case of childhood mortality. There is an outcome of the project. This is our success.
Holskolf IMAG, with United Nations Children's Fund support, is providing early essential newborn care according to the standard requirements and has scaled up the kangaroo care method since 2013 in order to reduce newborn deaths and to promote maternal and child health. Kangaroo care method has been shown to strengthen the bond between mother and a child and to prevent maternal bleeding and childhood infection. A potentially harmful practice of bathing a newborn baby immediately after the birth has been replaced with a practice of drying the baby and placing the baby on the mother's bare chest to practice skin-to-skin contact in the first 2 to 90 minutes after birth. It has also been shown that clamping and cutting the umbilical cord after visible pulsing stops helps prevent childhood anemia. Skin-to-skin contact allows maternal skin bacteria to prevent newborn infection and reduces newborn stress by allowing it to feel maternal heartbeats and bowel movements. Such soothing promotes breastfeeding and sleep. Breastfeeding builds up the child's immunity. Provisions of early essential newborn care in the General Hospital of Holskolf IMAG are helping to steadily reduce newborn mortality.
We are working to improve early essential newborn care since 2014. We have established teams in all health facilities and promoting teamwork. These teams identify challenges in improving early newborn care at given health facility, develop plans for improving the care, and implement the plans. As a result, we have first of all taken measures to supply health facilities with soft, absorbable baby wipes. Second, every measure is taken to keep baby wipes warm at all times. And third, the ambient temperature at the delivery ward is kept at 28 or more degrees Celsius. In other words, the issue of heat loss has been resolved. In addition, we practice skin-to-skin contact. All obstetricians and health managers have been trained in order to make this practice routine.
Not long ago, maternal and child health and other social services were not equitably accessible. Population health literacy was poor, information access was restricted, and childhood mortality was high in Holskulth IMAG due to the lack of coordination between public administration and service organizations. Therefore, the Reaching Every Somme and Bog strategy, as well as the Communication for Development strategy, have been implemented, and early essential newborn care has been introduced since 2012.
In terms of early essential newborn care, the delivery ward of our provincial general hospital has introduced a comprehensive package of very simple yet essential services effective in reducing newborn mortality. These services have been successfully relocated in our hospital, and as a result, newborn mortality is declining. Second, we are implementing the Reaching Every Somme strategy in 17 SOMs and 2 family health centers. Third is the Communication for Development strategy. United Nations Children's Fund has launched a major regional policy which has been implemented widely. It has been proven that very simple practices, if mastered by parents, can reduce childhood morbidity and mortality. Regional strategy based on this evidence served as a basis for us to develop a Communication for Development strategy on maternal and child health for our IMAG. The strategy has been approved to be implemented until 2017. It will contribute to improving parental knowledge and attitudes regarding timely health care seeking and disease prevention. In SOMs, we already witness reduction in childhood morbidity, hospital admissions, and emergency calls. We believe this is a result of equitable provision of low-cost, high-impact preventive services for the benefit of the many.
The Child-Friendly Community Initiative in Holskulth IMAG clearly demonstrates that geographical remoteness is no excuse for service inaccessibility. The parents and healthcare workers should join their forces in the quest for maternal and child health, and that shared development is possible through the expansion of knowledge. Participation initiatives and joint efforts remove inequities in public service provisions and lead to reductions in maternal and child mortality.